I'm Dr. Margaret Lafferty, live from the 2017 Hot Topics in Neonatology meeting here in Washington, D.C. We're joined by Dr. Stefan Pearlman of ChristianaCare Health System, and we're here to discuss his talk on root cause analysis, a core tool for patient safety. Welcome, Dr. Pearlman.
Thank you.
Thank you for being here. Dr. Pearlman, can you tell us what's the main overall objective of your talk?
Well, I think what we wanted to highlight was the importance of root cause analysis and how it has an important role in patient safety. I don't think that people think about root cause analysis in those terms enough.
Can you elaborate on that? What is that important role?
Well, the first step in any sort of safety operation is firstly that somebody reports a problem. And then once a problem is reported, it has to go through some sort of event analysis. And the most severe events go through what's called a root cause analysis. In the past years, it was very common for people to get blamed, individuals to get blamed for things that they had done or had not done that may have, or people felt resulted in an error. But we've moved into a new era, and the new era is really that what we need to do is think about the system of care. And it's not really what the individual did, it's not about their performance, but rather it's about the system of care that either helped cause that error to occur or allowed an error to occur to reach the patient, to get all the way through the system. So we're going to make mistakes, that's human nature, but it's the system that we work in that allows those mistakes to cause harm to patients. So we have to really change our whole approach to evaluating events and keep in mind the importance of the system rather than human error.
Thank you. Can you describe a little bit for us how we really get at that root cause analysis?
Yes, well, what we discussed at our seminar yesterday was that there are a number of different tools that can be used that can help sort of pick apart the various steps in a process of care, can look at what the human factors are, what the patient factors are, what the environmental factors are, all the different aspects of our healthcare system that can contribute to an error occurring. And that is what we tried to teach people yesterday. As a matter of fact, we did that by giving them a sample case that they worked in groups on and analyzed and then reported out to the rest of the group what they thought the root cause was for the event.
Oh, great. Could you tell us what that sample case was?
Oh, sure. It was a case, a neonatal case, of course, because we're at a neonatal meeting talking to all neonatologists, and I am one as well, that was about a baby who received an incorrect dose of a medication and suffered some consequences from that. And, you know, it was a multi-layered problem where a physician gave the order as a verbal order. The nurse didn't hear it correctly. She filled the order. Nobody double-checked her on that. And then the baby got this excessively high dose of a medication, which was a sedating medication and caused the baby to stop breathing, and then emergency measures had to be taken. So it was quite interesting. I think each table came to a slightly different conclusion, but they took it seriously. They used the tools that we taught them about, and I think they have a better understanding of what the process of root cause analysis should look like.
Fantastic. What would you say is the main learning objective that you would like the audience to take away?
I think the main message we tried to get across is that human error should never be considered the root cause of an event, of a sentinel event or any kind of event, that it's really more related to the system in which we function.
That's great, thank you. Are there any other important points that you'd like the audience to take away?
Well, I think we just have to also be cognizant of the critical role of reporting, and that if we change our mindset away from the blame and shame environment that we had before, that will promote people to report more events. Right now, according to most of the existing literature, only about 10% of events are reported in the healthcare system. If people realized that they weren't going to get blamed or they weren't going to get somebody else into trouble by reporting something, then they would be much more likely to report things, and we would be able to improve the care and make the hospital and our work environment safer for all the patients.
That's such an important point. Thank you very much, Dr. Pearlman.
And thank you for having me.
Absolutely. That's a wrap here at the 2017 Hot Topics in Neonatology meeting here in Washington, D.C.